Right, guys, this should be our last one on the Renaissance. Should keep this pretty short. We're just looking at care and treatment during this period. So mainly the healers and things like community care, pest houses, and hospitals. Right, to start off, I like this graphic to give you an idea of what's changing and what's continuing. Okay, so firstly, you've got alchemy during this period. The Paracelsus, he really inspires a lot of this, and it's just a new way, like a branching off herbal remedies, so to speak. Mercury being a big factor. Another thing, College of Physicians coming up with new chemicals to treat different illnesses. Again, reads into alchemy here. Transference, the idea that illness could be transferred from a patient to something else. Things like onions, you'd rub it on yourself and that onion will then get the disease and free you from it. Herbal remedies. Okay, so during this period, we know from Elizabeth, exploration is massive, and the more they explore, they're bringing back new different herbs. Sarsaparilla being an important one. They've also got spices like quinine, which is really important to be used in these new herbal remedies. So whilst that's kind of continuing, it is changing a little bit with the new recipes and continuity. So bleeding, purging. So the four humours. Although the four humours is dying off by the end of this period, religion's still a big thing. Although the church is weakening, and the idea of supernatural. So again, keep these in mind as we're thinking about the key words to this topic, which is change and continuity. Right, so again, just the new ideas. I'm not going to spend more time than I need to on this one. It's just same as I went through before. New herbal remedies, alchemy, transference. These are ones you're looking for. All right, prevention. So again, considered the best way to avoid dying. Prevent it before you get it. So we've got things like the Regimen Sanitatis from medieval period. That is still around in the Renaissance. It's a really good one to be aware of, the Regimen Sanitatis. So it is very similar. However, with the rise of syphilis, people kind of avoid the bathhouses, so the clean aspect changes a little bit. Miasma, big one. So there's a lot more emphasis in this period in cleaning the streets, sorting out sewage, draining bogs, and the superstition. So idea of moderation, again, is really important. I know we have that in the Regimen Sanitatis as well, but in this period they're really focusing on not drinking too much, limiting fatty foods, etc. Okay, the healers. So firstly, we've got the physician. Similar to, again, these are quite similar to the medieval period. They study at the university, keep a note of the amount of time they spend there. Tor, Galen, Hippocrates, but later on it will be Vesalius, Paré, Harvey. They're only going to be in the large towns and cities, and that is because they're expensive. They're only for the rich. So if we're answering a question based on the effectiveness of healers or who uses what kind of healer, physician, it's going to be more of the few, isn't it? Because peasants and the majority, they can't afford them. Right, the surgeon, again, similar. They are trained by watching and copying of surgeons in an apprenticeship. They're not formally educated, they learn on the job. Again, physicians might send someone to a surgeon, license the local bishop to treat patients and charge fees. Also surgeons, again, we can link this a lot to the Elizabeth period, because in the Elizabeth period, which in Elizabethan England, we see the rise of guilds in the towns and the merchant guilds. This is the same for like surgeons. You get guilds of surgeons there, which forms the apprenticeship. So just keep that in mind. Similarly to the surgeon, the apothecaries are part of a guild system as well. Again, same as medieval period, sells and mixes medicines. As I said before, they've got more training with this guild system. They need that license to actually trade. They're only in towns, and they're not supposed to provide treatments themselves, but they generally do for a small fee. Because remember, apothecaries, they are not bound by this Hippocratic oath. And the travelling quacks. So you're probably more familiar with these from the Great Plague. They're cheap. The chances really no training at all. They would have people working for them to try and big up their miracle cures, so to speak. Apologies, Ollie, I know you hate that phrase, I'll try not to say it. They would claim they could cure pretty much everything, but it wasn't the case. Remember, the travelling quacks preyed on people who were desperate, people who had no other choice, and they made money off that. Hence why they were popular in the Great Plague. Okay, where do you get medical care? So again, hospitals. So we know from the Elizabethan period as well, the Reformation is going on, and Henry VIII, he closes down a lot of hospitals. So they massively reduced during this period. From the medieval period, we know that it's very much for hospitality. It was just for food, shelter, prayer. People did keep patient records. However, later on in the period, a few hospitals start popping back up. St. Bartholomew's pops up, and physicians start to get involved. So it's not quite like the industrial period, but the fact that physicians start to get linked to the hospital shows that that changing from pure hospitality to more treatment. And we've got our pest houses. So the pest houses, again, part of the understanding that these diseases can be passed from person to person, so they're completely separated. The main known pest houses are the plague houses or the pox houses. Again, have a read, make a few notes, because you do need to be aware of them. Leprosy is also one of the big ones for the pest houses. And your community care. So this is your wise woman, the eldest woman in the family, etc., the eldest woman in the village. They would also always have passed down knowledge. They are normally free. They would have herbal remedies. They were most accessible one, because remember, peasants wouldn't earn a lot of money. Wouldn't earn a lot of money, so they would provide that care. Right, we'll leave it there for the Renaissance. Remember the overriding themes here. A lot of the questions are all about progress in knowledge and understanding, and I'll bang on about that all the time, but it's where the big questions lie. Just have it in mind what's happened since the medieval period and how things have changed in the Renaissance period, as well as what has stayed the same, because you use that to balance your argument. I'll be back with some industrial stuff soon.